Hello guys, welcome to the sixth part of our series. So, if you are joining from this part, I will advise you to watch the previous parts of this series. We have already made 5 parts in which we have discussed different MCQs which are relevant and very important for the RRB examinations. So, let's begin with the part 6. So, in the part 6, the first question that we are going to encounter here, it is a gradual rise in the venous pressure with normal arterial pressure during hemodialysis is most commonly due to. So the option A is air in the dialyzer. Option B is clotting in the dialyzer of the venous chamber. Sorry, clotting in the dialyzer or the venous chamber. Option C is dialysate flow error and option D is hemolysis. So what is the possible reason for the gradual rise in venous pressure? And it is also saying that the arterial pressure is normal, so the right answer will be clotting in the dialyzer. Now let's see what is the explanation. If the venous pressure slowly increases while arterial pressure stays normal, it is usually it usually indicates what uh, it usually indicates resistance on the venous side of the circuit. The most common cause is clot formation in the dialyzer fibers or venous chamber tubing. The partial block blood return raising venous pressure. So it is always due to clotting, mainly due to clotting. The venous pressure generally rises. Moving ahead, the second question of this part says, which endocrine gland is primarily responsible for regulating metabolism? This question is from the biology part of class 11th, and I think everybody is aware of this, and the right answer is thyroid gland. Thyroid gland produces thyroxine T4 and tridothyronine T3, which controls metabolic rate, energy use and oxygen consumption in the body. Therefore it is primary endocrine gland that is regulating metabolism for the body. Moving ahead, leukocytes move along the chemical gradient towards the site of inflammation. This process is known as what? So option A is chemomigration, option B is chemotaxis, option C is chemotrophy, and option D is phagocytosis. So the right answer here is chemotaxis. Why? Let's see what is chemotaxis. Chemotaxis is the movement of white blood cells, WBCs, along a chemical gradient towards the site of infection or inflammation. Chemical signals released from damaged tissue attracts leukocytes to the affected area. So the phenomenon is known as chemotaxis, and what happens here is WBCs, they move to the damaged site. Why they goes to damaged site? To cure that particular area or the affected area. Next question is, according to AMI dialysis water quality standards, what are the maximum allowable limits for bacterial count and endotoxin levels in the water used for dialysis? So option A is less than 200 CFU per ml and less than 0.5 EU, that is European units, per ml. Second is 50 CFU ml and 0.125 EU per ml. Option C is less than 200 CFU per ml and less than 0.05 EU per ml, and option D is less than 100 CFU per ml and less than 0.25 EU per ml. So the right answer here will be option C, that is less than 200 CFU and less than 0.05 EU per ml. So according to AMI guidelines for dialysis water, bacterial count should be below 200 CFU and endotoxin level should be less than 0.05 EU per ml. Maintaining these limits prevent pyrogenic reactions and infection in the dialysis patients. Moving so in the fifth question of this part, the question says the formula for ultrafiltration rate in dialysis is. So option A is UF rate is equal to QD multiplied by KF by volume. Option B is UF rate is equal to QD into blood flow rate. Option C is UF rate is equal to KF multiplied by TMP. And option D is UF rate is equal to TMP into dialyzer surface area. So the right answer will be option C. So let's see. Ultrafiltration depends on dialyzer ultrafiltration coefficient, that is KF, and the transmembrane pressure, that is TMP. When increasing TMP or using a dialyzer with high KF, that is ultrafiltration coefficient, it increases the overall removal during the dialysis, overall fluid removal. So this is a very important formula and we have to remember it. Moving to the sixth question, it says which of the following factor enhances solute removal by diffusion during dialysis? So option A is increasing dialysate solute concentration gradient. Option B is decreasing dialysate flow rate. Well, if we decrease the dialysate flow rate, what will be going to happen? The solute removal will also get slowed down, so it is negatively going to impact. It is going to impact negatively to the overall function of solute clearance. Option C is decreasing dialyzer membrane thickness. Yes, if we decrease the membrane thickness, the solutes will be able to move more easily through the SPM. Option D is using high molecular weight solutes. No. So the right answer will be option C, decreasing dialyzer membrane thickness. Diffusion becomes more efficient when the membrane is thinner because solutes can cross more easily. Increasing concentration gradient also help diffusion, but among given options, the thinner membrane directly enhances the diffusion efficiency. Moving ahead to the seventh question, it says who is in the dialysis chain mainly responsible for patients' nutritional assessment? So it is particularly role-based question, and who will take care of the nutritional assessment? So option A is renal dietitian, option B is nephrologist, option C is social worker, and option D is dialysis technician. So obviously nutrition is related to renal dietitian. So renal dietitians evaluates the nutritional status recommended. Nutritional status recommends protein, fluid, sodium, potassium, phosphorus intakes, and helps prevent malnutrition in the dialysis patients. This is their primary responsibility in the dialysis chain. Moving ahead, eighth question in the series, it says which of the following is most common cause for initiating emergency hemodialysis in patients with acute kidney injury? So most common cause for initiating emergency hemodialysis, we have to start in a patient with a AKI. So the patient is AKI patient, and what is the most common cause? So we have to find the cause and we have to start the dialysis, initiate very it is a very urgent dialysis. So what will be the symptom that we are going to see on the basis of what we are going to start the emergency dialysis, and the patient, they have told us it is AKI based. So option A is pulmonary edema, option B is severe metabolic acidosis, option D is uremic encephalopathy, and option D is hyperkalemia. So we will definitely go with the hyperkalemia, because in hyperkalemia what happens, severe hyperkalemia is life threatening because it can cause fatal cardiac arrhythmias, and it is most urgent indication for emergency dialysis, especially AKI. Moving ahead to the ninth question of this. So it says which fluid is commonly used for priming dialyzer circuit before initiating dialysis? So this is very basic question. Every dialysis technician knows it. So how we prime the tubings? So we prime that using normal saline, that is 0.9% weight by volume. So normal saline is used to prime the extracorporeal circuit before dialysis. It removes airs from the tubings and ensures the circuit is safe before continuing to the patient. Moving ahead to the last question of the part 6 here. It says What is the recommended serological test to assess active hepatitis B vaccine response in a dialysis patient? So the question is saying that we have to assess active hepatitis B vaccine response. So hepatitis B vaccine is given to a patient and we have to check for it. So the answer will be options are anti-HBS, option B is anti-HBC, option C is HBeAg, and option D is HBsAg. Since we have given the vaccine and we are checking for the response, the right answer will be anti-HBS. Anti-HBS antibody levels indicate immunity after hepatitis vaccination. Dialysis patients are routinely checked for anti-hepatitis B to ensure adequate vaccine response and protection against hepatitis B infection. So here we have discussed 10 questions in this particular part. Hope you enjoyed the series. Stay connected, stay tuned, and the practice sheet will be given in the Telegram group. So do check, and if in case you have not followed the Telegram group, please do that. So hope this video is helpful. Make sure to like it. Thank you. Have a nice day.